Hello, everyone. Welcome back to the Dental Hygiene Basics podcast. My name is Dana. I am your host and very excited to have a special guest with us today. Her name is Nancy, and she is a new grad. So we're always excited to get, former students, or I guess we're all former students at some point, all of our guests, but excited to have people who were through it recently and can really share their experience. So, Nancy, thank you so much for being here.
Hi, Dana. Thank you so much for having me. I'm excited to share my experience.
Absolutely. Well, we're going to dive right in. And the first question that I always ask is basically, what's your RDH origin story? What got you interested in dentistry? How did you get to this point?
Yeah, in the beginning, I was originally planning to go to dental school. So, with my background, I had actually gone to a university, San Diego State University, and I acquired my bachelor's in biology. And within that time frame, I was given an opportunity to assist. And from assisting, I was able to then get my RDA license, not in the most traditional way of going through a program. I had actually gotten it through work experience. And then from there on, I kind of just got more into the field of dentistry, kind of seeing how everything plays out. And then ultimately, I decided that I was more up for the prevention side. I do love restorative dentistry, and I still do kind of think about if I want to go back to dental school. But I think currently, right now, I love the preventative side. I feel like for hygienists, we're like the first in action, where we're essentially seeing if there's any inflammation or such and kind of combating it before it starts deteriorating and getting into other things. So, yeah, I've been
Yeah.
very thankful, and it's been an eye-opening experience to see how different the restorative and the dental hygiene side has been.
Yeah, that's great. I love it. I know it is a very different. And not even path, but a very different I don't even know the word. Like you said, like, it's not the motivation behind it because I know we all care about getting patients healthy and you want
Oh,
them to all, be in good health but there is a difference between prevention, like catching the disease early and treating it early, and then restoring, which is, oh, the disease is there, now we have to fix what's broken, basically. And it is really fun to be on the other side. And I think maybe some students don't always recognize that. They think, "Oh, I want to be a dental hygienist. I get
mhm.
great hours and I, make good money and like all these things, which are great. Like no shame there, but at the same time, what are we really doing it for? And I think that that's what's really interesting about our career as dental hygienists is that we are prevention specialists and there's no other career that acts like that. So it's really exciting. Okay, so let me confirm because I get so excited when my guests are talking that I'm like, wait, okay. So you have a bachelor's from San Diego State. Is that
Ye-
right? Okay.
Yes,
And that was in biology.
yes.
Okay. And while you were in school, that's when you started working as an assistant, or was it after you graduated?
It was during COVID, so I believe I had gotten the job officially in 2020, and it was, peak pandemic, and, I think during that whole time, it really pushes you to learn a lot of how to navigate within the dental office, patients, and then procedures. And starting off, I didn't have any prior dental knowledge or so. So having to work from bottom up and having to get through that learning curve of dentistry was intense. I remember thinking to myself, like, oh my gosh, do I really want to do this? And I think thankfully with dentistry, it's repetitive. It's just different techniques. And eventually something just clicked in me where I finally understood. And then we had that aha moment. And from there on, I was like, I think I really do like this. And it just beautifully blossomed afterwards.
Yeah, I love that. So were you still in school at the time while you were doing all this through COVID and working?
I was working full time in my senior year because everything was still shut down. So everything was still through Zoom. And I believe all the exams were still through Zoom and online. So I think thankfully, with that kind of happening, I was able to really pivot my career. And from there, I do tell to a lot of people, I think during COVID, I think that's probably when, unfortunately, when everything was closed, I flourished because I was able to get into my field of my passion. And then I was able to learn so much within the time frame as well. And then all while being able to complete my degree.
Yeah, I mean, that's incredible because I think a lot of people didn't have that similar experience. And honestly, during COVID, there was a mass exodus. I mean, a lot of dental professionals were leaving the field, right? So, kind of a perfect opportunity for you to step in. And our students who are listening, they may or may not know that in some states, you can be trained on the job as a dental hygienist, or excuse me, not as a dental assistant, although they're trying to push some of these, trained on the job for hygienists, but that's another story for another day. Yeah. But no, that's great because it got your foot in the door, got you started. And I was thinking you mentioned you're still interested maybe in restorative because you're in California, right?
Yes.
Yeah, so in California, they have the expanded functions dental assistant. So could you go back and do that as a hygienist and assistant, like kind of tag team?
Yeah, I've thought about it many times because I'm the type of person who, once I get into something that I want to do, I tell myself like, "Oh, maybe I just wanna do, like, the most maximum thing to the best of my abilities." Like, I've already after getting this RDH license, I already do plan on wanting to get my alternative practices once after we've acquired the amount of hours to hit it and then apply. But I do think about sometimes the expanded functions because at the end of the day, restorative dentistry is still so interesting, and I think when you have that background as a hygienist, that really does help everything come together of, not only do you have to take care of your hygiene, but you also have to make sure that, you're keeping up with any restorative work that needs to be done. Like, it kind of goes hand in hand. Like, you can have maybe the best oral hygiene, but unfortunately, you just get a lot of cavities, or you can not get a lot of cavities, but you can still have a lot of bone loss. So I think understanding on that part really helped a lot when I was in hygiene school.
Yeah, yeah, for sure. I know. And that's one thing that I think we do when we don't know alternative pathways is we box ourselves in. I felt that way whenever, I thought, "Oh, I want to be a dentist," right? I
Mhm.
really in my mind, I wanted to be a doctor. I thought like you, and I'm not saying you shouldn't do this. I think you should do whatever your heart is called towards, but you mentioned when you want to do something, you want to do it to the highest level. That
Yes.
was me. I thought, "Oh, I want to be a dentist. Like that's the highest level. Maybe I go further than that. I don't know." And then the way that life circumstances worked out for me, I ended up in hygiene and it was the best thing that ever happened to me, but I'm the same. Now I'm like, "Well, how do I get to the top of where I'm at here? Like how do I continue to seek opportunity and do all those things?" And one thing that I've learned is the pathway doesn't have to look how you thought it was going to look, right? You like restorative, well, you could get your expanded functions dental assisting license and do small restorations and things like that, whereas other states may not be able to do that. Or if you're like, I love that, I want to do more. Okay, you go to dental school. There's so many paths to do these things. And I think that's just what's beautiful about starting with dental hygiene because really the sky is the limit from there. I mean, yes, you may need more education, experience, networking, all of the things that come along with it, but it's just such a beautiful place to start or finish, whatever that looks like. I think for anyone who's interested. So tell me a little bit about your dental hygiene school experience because you went to an accelerated program, right?
Did, I did. Because I had graduated from my four-year university. And because I was in the process of, do I want to go to dental school? Do I want to do hygiene? It really got down to a point where I was like, oh man, it's like I have to really think about what I want to do. And the school that I chose to was accelerated. It was easier just because I didn't want to do a lottery system with community colleges. And although the tuition would have been much lower, I think at that point I was already on my second gap year and I just wanted to get the ball rolling. And in my thought process, and I still think about it too, I was willing to pay a lot of money for dental school. And for the accelerated program, I was like, if I think about it, it'll pay off. And if I was willing to pay almost 500K in loans, then with tuition, the accelerated programs, they're very expensive, about 90 to 100K. So in my process of thinking. I was like, "Oh, if I'm willing to pay that much in tuition, I wouldn't mind paying this much in tuition for dental hygiene." And in the end run, money comes back tenfold. That's my motto.
I love that. That's a really great way of thinking. It's something
Mhm.
I have more of a scarcity mindset. So I try and not be that way, but it's something
Yeah.
I'm like, okay, now I say to myself, money going out is money coming in, right? Money going, and it takes some exercise to trust in that, right? And not to
Mhm.
say you can just make crazy decisions and it's going to pay off, but dental hygiene is an investment in yourself
Yeah.
and your future. And like you said, when you put that money forth, you graduate. Now you're making money as a dental hygienist. So, did you mainly take out loans for your program?
I did just because a lot of my federal loans had gone to my federal loans and my grants went straight to my 4 years. So by the time that I was applying for my accelerated program, I think they maxed out on my federal loans, and then the other half I had to take it on private loans. So currently, now that I've graduated, now it's just more of refinancing and, making a game plan. But at the end of the day, for me, I think of loans as an investment to myself. Not everybody wants to, be in debt, but sometimes you do have to take that chance on yourself. And, I think if you believe in yourself and you know that you'll be okay in the end run, then everything will fall into place.
I like that. You're the second person I've interviewed recently who has that mindset surrounding debt. And I think it's really good because my perspective has changed. In the past, I was like, no, debt is bad, but debt is a tool. And when used responsibly, it can be a great tool, right? It's when it's used irresponsibly that it's a problem.
Yeah.
And so now that you've graduated, are you out working clinically?
I am. I actually just signed into my permanent job, but currently I had just been temping around and I don't mind temping. I'm the type of person where if I don't feel confident in something, I'm still going to put confidence in myself. I always tell people, I was like, it's false confidence until it starts feeling like confidence. And I really like to tell people that I have probably the best poker face because I truly try not to show it. But temping was really great because I was able to see how offices ran, how their systems worked. And thankfully, as an assistant before, I did used to temp. So it's just weirder because when you're a provider, now I'm like, "Oh, man," like, I'm signing on notes, like, it feels so much more different when you're the hygienist compared to the assistant, and I think it's a beautiful thing, though, like, the improvement and the graduation of assistant to hygienist or assistant to provider is just a really great thing to see.
I love that. I love that.
Mhm.
Yeah. Tipping is such a great option. Did you ever temp as an assistant through dental hygiene school?
No, so me personally, I'm a workaholic. I believe, like, this time when I was in hygiene school, this is, like, probably the first time that I've ever had to halt anything work-wise, and it was a really weird experience, and I was like, "Man, I kinda like the unemployment life."
I know, I know. I'm a certified workaholic, so I get it. No, I'm gonna say recovering workaholic. I've really been working on doing that less and it's good. It's hard. I'm like, what do I do if I'm not working? That's my favorite thing to do.
Yeah, and yeah, I just knew myself that I wouldn't focus as well in hygiene school if I was just constantly working. Thankfully, the school that I went to, my family lived really nearby. So I essentially, you know, made my plans. I was essentially like, okay, I'm going to move back with family. We're going to make sure that we solely focus just on school and just school, like no working. It's going to be awful, but, it's doable. It's a sacrifice that needs to be done so that we can, pursue this higher education, pursue this career. And now that we're off, like now that we are in the end run of it, I'm so thankful that I took that time to actually take a rest from working. I've worked since I was 16. So just to finally feel the break from all of that, I was like, oh man, it was well deserved,
Yeah.
needed.
Yeah, yeah. I know. I like that you say it was well deserved, much needed, but you were also going through dental hygiene school, which is like it's a full-time job, it's a lot of work. So once
Gosh.
you got into dental hygiene school, first off, my first question, comparing dental hygiene school to your bachelor's in biology, which one was harder?
Oh my gosh. You know what's really funny is that looking at my GPA, my hygiene school was a lot better, but I was working when I was in my undergrad. So I knew I wasn't going to be able to focus at all if I was working. But hygiene school was definitely harder. I would say I made the best out of hygiene school. It was honestly the best. I made sure that I kept a very positive mindset and attitude. And I think at that point, I was ready to take on further education too. Going from high school to college, you're still kind of stuck in that mindset of, I don't know what I really want to do. Some people have it right then and there. I think for me, I kind of made a plan and just stuck with it. But at the end of it, I was like, oh, I don't really know if I wanted to do, one path or another path. And by the time that I hit hygiene school, I was fully immersed in wanting to learn, wanting to further my education. Like I really wanted to actually like sit down in my lectures and like actively listen. So I don't know. I would say hygiene school is a lot harder because it really pushes you to the limit, and you also had to recruit for patients, which that was also like a job itself.
Absolutely. So do you have any tips for how to find patients in dental hygiene school?
I helped my classmates on recruiting because I have a lot of family and they were everything that I really needed. I think in my last term of hygiene school is kind of when I started asking family, like, hey, are you able to ask your friends or your friends' family members? I got really lucky in the sense of hygiene school, but because I was good in those parts, I would help my classmates because I didn't want anybody to fall behind. For recruiting, I would say we blasted flyers off of Reddit, Facebook Marketplace. I was very passionate for my classmates. So I told them, I was like, give me your flyers, your business cards. And I would go to, Walmart and the toothbrush or the dental sections and kind of place it there for them. And I'm a talkative person. So this one thing that I would always do too is I would go to stores like Sephora, Ulta, any store that has like a sales associate having to come up to you because they have to come up to you to see how you're doing, I would be like, "Oh, I'm doing great." And I would just strike up a small conversation. And then I would be like, "Oh, I'm actually a dental hygiene student looking for patients for my classmates. Here's their business cards." And I would say if you're a shy person, I would say do that route because when you go into those, like, what would it say? If there's like a sales associate or anything, they have to talk to you just to see how you're doing. And if you're kind of on the shyer aspect, do that because then you're like, oh, okay, like I don't feel like I'm bothering them. And yeah, at the end of the day, I think as long as you're actively pursuing patients, out of the 50, even one patient coming in is going to be, the reason why you're progressing through your hygiene school experience.
Yeah, yeah. I love what you said about basically, you're going to get accosted by a sales rep when you go into these stores. You might as well turn it around on them and say, "Hey, while you're here and I've got your attention." Yeah,
Mhm.
and if you think I like what you said too, if you're a naturally shy person, that's a great opportunity to do it because they're getting paid to talk to you, right? And you might as
Yeah.
well just like leave them a card and say, "Hey, this is an option. You're doing something good for them because you're helping their oral hygiene. It's usually at a lower cost, right? Yes, it takes more time, but they may have the time. You don't know. Like you can't assume a patient does or does not have the time available until you have the conversation. And I used to be really shy and I feel like I was the same way. Like the more you push yourself into these situations, it's like exposure therapy, right? The more you can expose yourself to putting yourself out there having conversations, it's like you just get a little bit more comfortable the more and more that you try it. And
Yeah.
honestly, that's how networking happens too. You just gotta be comfortable being like, "Okay, I don't know, maybe we'll flounder, maybe we'll talk about something random," but the beauty of networking at, like, a dental hygiene conference is everyone can talk about dental hygiene. So, if you get really stuck, that's a great place to go, if you're trying to network with professionals. But, yeah, I really love that. So, you recently graduated, you took your boards, you were successful, you did all the things, which is incredible. What is your last big piece of advice that you would give to a student, maybe a student who is struggling?
I would say, you know, keep a very positive mindset. I know it's so hard for you to feel down during hygiene school and, you know, maybe feeling down from clinicals, from comps, from back to back exams and tests. But just remember at the end of the day, this is where you wanted to be and you're going to pass. If a failure is never a failure, it's a redirection. And at the end of the day, it only makes you better. I would say that if you feel like you're really struggling on topics or subjects, reach out. What I would do is I would just reach out for any assistance from any instructors or even classmates. If there's a subject that you really truly don't know, reach out to a classmate that's pretty good in that subject. And, I think having the best possible mindset and trying to be optimistic will be the best way to go through dental hygiene school. At the end of the day, you'll look back into it and you'll be like, it was a blink of an eye,
Yeah.
truly. But yeah, I think dental hygiene school is definitely really hard, but nothing easy comes without tough experiences. You will cry, but it's okay. You will have a great support system, hopefully from instructors and from your cohort. And at the end of the day, you'll be just fine. And in the end run, you're going to be an amazing hygienist.
Yes, such great advice. And I really like what you said about going into it. You made the decision to be positive
Mm.
because we hear about all the negativity. I mean, you said
Right.
you're going to cry, but you could slap a smile on while you're crying and be like, this sucks. It's terrible. But you know what? When you're smiling, like it signals to your brain, it's all going to be okay, right? It's all going to be okay. And it's a choice. And it's a really hard choice to make to be positive every day. And realistically, we're going to have good days and bad days, but I think you can make it an overarching theme of your life where, you strive towards positivity and you will be rewarded with positivity in return. I do believe that. And I think you're on that on everything. You're like money out, money in, positivity out, positivity in. So I think that's great. But what is one of your favorite memories in dental hygiene school?
Oh man, there's so many. I had a really good dental hygiene school experience. I would probably say I'm like the odd one out. Like it was a joy in hygiene school. I loved all my instructors. I still keep in touch with them. I still keep in touch with all of my classmates. I think the best memory was just, man, there's so much. I think the best memory was when we were just all numbing each other and just in the group chats. I think somebody had a hematoma,
Oh, no.
but we just make light of everything. And there's so many. I remember even in hygiene school when we had to do a lot of presentations. I think one of them we had to do a and ours was Vegas, and I dressed up because I'm extra like that. I essentially dressed up with like a cheetah fur coat and like a hat. And then because we were Vegas, I got like money guns. So when we ended the presentation, we just like pulled out the money guns and like sprayed the classroom. We cleaned it up afterwards, but yeah, it was a great time. I tell people all the time, I was like, dental hygiene school was hard, but I had a blast. Would I do it again? But it was a great experience. I would tell people, like, don't be scared going in. I think as long as, you go in with an open mind and you're respectful and, you're willing to learn, you'll have a good experience.
Yeah, I think that's great. I have a question and I don't know if you'll want to answer it or not. I'm wondering if this is you because you're so positive or if it's like your class and I know you had a great experience, but do you feel like
Mm.
most of your classmates would say they shared that same experience? Like they overall wouldn't do it again, but enjoyed it at the very least.
I would think so. I think my cohort would say that yeah, I think they would say they would never want to repeat hygiene school, but I think they could probably say like everybody got along, everybody worked as a team, and I think you can really see it when we had our white coat ceremony. It was just full of beautiful memories and pictures of just us, laughing and smiling. And yeah, I think for the rest of my cohort, I think we would all say everybody was great to each other.
Yeah, that's amazing. And that
Mhm.
makes me so happy. And it is something that I think I'm seeing. I think I'm seeing a shift. It's maybe not happening everywhere, it's not happening all at once, but I do think that we're seeing a shift towards a more positive dental hygiene school environment. Does that mean that it's easy? No. It is hard. I mean, and that's like you said, anything that's worth doing is the challenge and you're going to go through tough experiences, but it is all in that mindset, and I think that I do think we're starting to see some shifts around maybe that full-blown negative experience,
Oh my
that you
god.
hear about online all the time. It's getting a little bit better, I think.
I used to hear so many negative things about dentistry, and I think even before I started hygiene school, I had some previous coworkers that would tell me about their hygiene school experience, and I just remember looking at them like jaw dropping, like, I really hope my experience isn't like that, and then I think once after I came, I think I was in the mindset of like, "No, I'm not going to have that experience at all." I, like, refuse to have a negative experience, and yeah, I would say I tried to talk with everybody, and I joked with a lot of my instructors, and it was very playful. We were all very playful with each other, and we still got things done. So I think at the end of the day, like, that was the biggest thing, where it was like I try to take light of everything, but also in a sense of welcoming feedback because I can't get better at anything if I'm always getting or hearing like, "Oh, you're doing good." Like, no, I want to hear, like, how I'm doing. I think that's also, like, a mindset thing where it's like if you don't know if you can take feedback, well, it's okay. It's not a skill that's, like, easily attained. It's something that, you have to hear the feedback and you have to feel in that realm of, "Man, like, that didn't feel good at all." But, take that feeling and reverse it and just, I don't ever wanna feel like that ever again, and with that, I will do better, and that's the only way that you really can show your improvement in hygiene school is taking all the constructive feedback and then turning it into a positive. No one ever wants to hear that they're not doing a great job, but, I think if you think, "Thank you, like, that feedback was really needed," and your improvement will show. Like, your clinical skills will show at the end of the day, and also, you're in hygiene school once, take advantage of talking to your instructors. Like, to this day, I, like, still miss listening to my instructors because they were all phenomenal educators. Like, I will text them, I'll be like, "Hey," or I just update them of how things are going. But I would say just really listen in onto what your instructors are saying to your patients because you're never gonna get that experience again.
Yeah, that is such a good point, and I like what you said about, it's very rare that someone takes feedback and it doesn't feel like it chips away at your soul. Like that is a normal experience, especially like if you didn't see it coming, if you thought you
Yeah.
passed and all of a sudden you failed. I mean, that's really hard. But I really liked what you said about, asking for feedback because sometimes people are like, okay, everything looks good. And it's okay afterwards, like after a clinic, to go and say, hey, I know you said everything looks good. I would just like to check in. Is there anything that I could be doing a little different or a way that I can improve? Maybe and ask yourself, what are you struggling with? Maybe I'm still moving a little slow on probing. Hey, do you have some feedback on how I can get faster? Or I'm still struggling with this area. Can we look at it together? Self feedback is important. And then, asking for feedback from others is important as well. And it goes back to that exposure therapy. The more feedback you get, the less scary it is. And that's a great way to go about it. Well, I love everything that you shared today. I think it's so great to get a recent student's insights. And I know that the students will love this podcast episode. Tell the students where they can find you if they have questions, if they want to reach out to you, and then we'll wrap it up.
Yes, you can find me on Instagram. You can always send me a DM, and I'm more than happy to help out. I love interacting and I love talking. If even if you need to vent, I'll be here.
That's
I
so nice. I know we all need that sometimes, right? So
yeah,
that's why I tell people, I'm like, even if you just type it all out and then at the end you're like, you don't have to respond. I just needed to send this to someone. I'm like, fire it
yeah,
off. That's fine. Just send
yeah.
it to me before you send it to someone else who maybe they don't need to.
I'll be your dental hygiene diary. I have
Yes.
it won't go anywhere. I'll be here. I'll listen.
I love it. I love it. That's awesome. Well, thank you so much, Nancy, for being here. We appreciate you.
Thank you. Thank you so much for having me.
Of course. And good luck with your new career.
Thank you so much.